depends on who is suturing and what you are doing. Typically, if you are doing a general case, you're going to be closing with like a floral monocryl PS2. That is a very popular skin stitch. When it comes to general surgery, nylon is another suture that they use a lot for skin, and that could be in ortho that you will not see as often in general cases. That might be ortho cases. Plastics might use some nylon too, or Prolene I've seen a lot of for plastics. I'd use a 2.0 nylon FS usually for a drain. Monocryl, PS1 or PS2, just depending on who's suturing. Prolene I've seen, but that has to come out, so that is typically an outside suture on top of the skin suture that will come out later because it's non-absorbable, as well as nylon is also non-absorbable. Skin staples are also used quite often. What specialty you are in will depend on what suture is most commonly used, if that makes sense. Monocryl, Prolene, nylon. Yeah, and monocryl I'm saying will go either way, Stratafix or regular. So those are the most common skin sutures that you would use, and there are all types of needles, and the needles also depend. If it's a general surgeon asking me for a Prolene for skin versus a plastic surgeon asking me for a Prolene for skin, I would assume it would be a lot smaller of a needle, and it'd be a cutting needle because it's going to be on skin. I would probably give a 5.0 Prolene on a P3 to a plastic surgeon, whereas I would give a 4.0 Prolene on a PS2 to a general surgeon. Again, this is my experience in the time that I have been a tech and a first assist.